I want to welcome you to Connaught Hospital. We are very pleased and grateful as a team to have this all-important body here this morning for the very first time in the history of Connaught Hospital to familiarize and create awareness on management strategies and service delivery generally at Connaught Hospital. We want to thank God for that. Our distinguished guests, ladies and gentlemen, today is an opportunity for the press to understand Connaught Hospital and the specialized healthcare service that we offer to the public. At this junction, we want to call on our very first speaker, who is Dr. Jubilah Faludin. Dr. Dean is a consultant physician by profession. He is a he has practiced medicine in Sierra Leone for 30 years. He is currently the acting chief medical director for the University of Sierra Leone Teaching Hospital and also the registrar for the College of Physicians and Surgeons in Sierra Leone. He is also a fellow of the West African College of Physicians. Ladies and gentlemen, Dr. Faludin.
Thank you very much, Mr. Chairman. Thank you very much. Thank you very much, Mr. Chairman. The Hospital Care Manager at Connaught Hospital, distinguished ladies and gentlemen, you are welcome to Connaught Hospital. My task today is to brief you about the University of Sierra Leone Teaching Hospitals Complex. The University of Sierra Leone Teaching Hospitals Complex was established in March 2016 by an Act of Parliament. This act signaled a new beginning and bright future for healthcare and care service delivery in Sierra Leone. The University of Sierra Leone Teaching Hospitals Complex comprises of 6 hospitals. So these 6 hospitals form the University of Sierra Leone Teaching Hospitals Complex. That is Connaught Hospital, Oladiyan Children's Hospital, PCMH, Kisi Psychiatric Hospital, Laka Infectious Disease Hospital, and Jue General Hospital. In addition to these 6 hospitals that form the USLTHC, we have affiliated institutions like the McKinney Government Hospital, Bow Government Hospital, Kenema Government Hospital, Choice and Emergency Hospitals. So the teaching hospital is working in collaboration with these other institutions. The University of Sierra Leone Teaching Hospitals Complex has 3 mandates, and the 3 are as follows. 1, to serve as an institution for both undergraduate and postgraduate training in medical and allied health sciences. Number 2 is to undertake research into topics and issues that are relevant to the Sierra Leone context. And number 3 is to provide advanced health services that meet the highest international and ethical standards of care. The governing body of the University of Sierra Leone Teaching Hospital Complex is the Board of Administration. The administrative head of the University of Sierra Leone Teaching Hospital Complex is the Chief Medical Director, and he is ably assisted by the Deputy Chief Medical Director and the Director of Administration. The Ministry of Health and Sanitation performs an oversight role of being informed of the key decisions taken by the Board of Administration without interfering into the day-to-day running of the teaching hospitals. So the Ministry of Health and Sanitation supervises without interfering. Since the establishment of the University of Sierra Leone Teaching Hospital Complex, the following departments have been established and accredited by the West African Postgraduate Medical Colleges: Internal Medicine, Pediatrics, Obstetrics and Gynecology, Surgery, Urology, Anesthesia and Family Medicine. And I must inform you that presently we are working very hard to get accreditation for psychiatry and radiology. What this means is that with your institutions and your departments getting an accreditation from the West African postgraduate colleges, you can now begin to train your own specialists and consultants locally. This will save the government of Sierra Leone a lot of money, because when the government has to send people abroad to Nigeria and Ghana and maybe to Southern Africa, in my case in particular, they spend a lot of money to send us there and to maintain us there. And the other good thing about being trained locally is the fact that whilst the doctors are being trained at postgraduate level, they provide service. If you send a doctor to Nigeria, you'll be providing service to the people of Nigeria. If you train your doctor locally, you'll be providing service to the people of Sierra Leone. So that is one of the good things. Like I said, each of the departments has been accredited by the West African postgraduate colleges. Presently, we have over 30 residents who are being trained in the various departments, not only at Connaught Hospital, but also at the other hospitals that form the University of Sierra Leone Teaching Hospitals Complex. What has happened recently is that in order to improve on the quality of service provided in these hospitals, Connaught Hospital and the other hospitals, several units and clinics have been established. And have been established at Connaught Hospital, Oladiyu Children's Hospital, PCMH and Kisi Psychiatric Hospital. For example, at Connaught Hospital now we have the Renal unit, we have a Dialysis Unit, we have diabetes, cardiology, oncology, and orthopedics clinics. At Oladiyu Children's Hospital, we have oncology, sickle cell, neurology clinic, and specialist outpatient. At Kisi Psychiatric Hospital, recently they have established an adolescent psychiatric unit. The creation of these units and clinics enhances subspecialty training, not only for doctors, but for nurses as well. Ladies and gentlemen, Connaught Hospital is like the big brother to all these other institutions. Since it houses the two main departments of internal medicine and surgery, Connaught Hospital is the flagship hospital. I stand here very proud to inform you that Connaught Hospital has top-notch, world-class consultants who are renowned not only in the West African sub-region but beyond. These are the people who serve as trainers and mentors to our young doctors. Many of these consultants are also accredited examiners of the West African postgraduate colleges. Having said that, we have many highly trained, highly knowledgeable consultants. However, in certain fields of medicine, we don't have enough consultants. And what the government has done is to recruit people from the sub-region in those areas of subspecialty that we don't have. That is why recently the government of Sierra Leone has recruited from the sub-region the following: 2 histopathologists, and these are the people who will be manning the mortuary and the labs, 2 psychiatrists, 1 anesthetist, 1 family physician, 2 gynecologists. And presently, a clinical psychologist is being recruited by the government of Sierra Leone. All of them are being paid by the government of Sierra Leone to enhance service delivery and training in these institutions. Ladies and gentlemen, Connaught Hospital and the other hospitals that form the Teaching Hospitals Complex, we do not work in isolation. We work in collaboration with other partners. For instance, Connaught Hospital has, over the past year, has been working with KSLP, King's Sierra Leone Partnership, at King's College in London. PCMH has been collaborating with the Mama Pekin Foundation and Johns Hopkins University. Oladiyu is collaborating with well-body partners. I need to mention QUAM, an Italian organization that is, whose presence is felt very much at PCMH. Also, Kisi Psychiatric Hospital is collaborating with partners in health. I must also inform you that The University of Silo Teaching Hospitals Complex, and in particular Connaught Hospital, we are collaborating with the College of Medicine and Allied Health Sciences. I want you to note this, and this is a fact. In all of these hospitals that I've mentioned that form the University of Silo Teaching Hospitals Complex, the following categories of patients are being treated for absolutely free. And these are pregnant women, lactating mothers, children under 5 years of age, Ebola survivors, disabled, and mudslide victims. Ladies and gentlemen, Connaught Hospital is changing rapidly, and under the leadership of the dynamic hospital care manager, Dr. Musa Fakaban, and the very hard-working hospital secretary, Mr. Fode Musa, the quality of service provided at Connaught Hospital has improved significantly. I once again would like to welcome you and thank you for coming. Thank you.
Thank you very much, Dr. Dean. Our next speaker will be Dr. Iyalebi. Dr. Iyalebi is a consultant pediatric specialist, a lecturer at the College of Medicine and Allied Sciences, and also head of department for surgery, both at Commerce and Connaught Hospital. Ladies and gentlemen, Dr. Lebi.
The hospital care manager, distinguished ladies and gentlemen, all other protocols observed. We in the Department of Surgery, like was said by the acting CMD, also have the core mandate of training, service delivery, and research. And we work in two areas in the hospital. The wards, which are the surgical wards, including the accident and emergency department, which is the entry point in the hospital, and the intensive care unit, and the 5 surgical wards. And we work in the theater as our second area, and that is where we carry out specialized operations in different fields of surgery. And at Connaught Hospital, the following disciplines in surgery are practiced. 1, we do general surgery on adults and children. We do ENT, which is ear, nose, and throat diseases. Trauma and orthopedic surgery, which is one of our core competencies that we do in surgery. And we have urology and plastic surgery, which has just been newly added to the department. And so it is important to inform this gathering that we now have the capability in surgery to perform plastic surgery operations. So you don't need to go abroad to seek services in plastic surgery. And as a pediatric surgeon, we do a lot of pediatric surgical operations at Connaught Hospital as well. It is also important here to note, because most times there is doubt as to whether Connaught Hospital does treat children. Because when you look at Connaught Hospital, the thing that comes to mind readily is this is an adult hospital. But I want to inform you today that in as much as we have a dedicated pediatric surgery hospital in the country, which is Oladurin Children's Hospital at Fobe Road, all children with surgical diseases are treated at Connaught Hospital. So this is where we do pediatric surgical operations. And also of note is the fact that, you know, one of the things that becomes a little bit doubtful is whether we do free health surgery. It's been mentioned as one of the free health categories is the under 5s. It is also good to inform this gathering that Connaught Hospital practices free health surgery. All of the operations that are done here on the under 5 children and other categories that have been mentioned already are done free. And it's of note that in my practice as a pediatric surgeon, about 80% of all the patients that I treat are under 5s. So they get surgeries free and they are all treated free of charge without asking them for a penny. In the area of training, let me outline the following. That the Department of Surgery, in collaboration with anesthesia, are actively also involved in training. At the moment, the Department of Surgery is training general surgeons, and anesthesia is also training residents. So right now we have 5 general surgery trainees at the level of the membership, and we've recently are the 4 candidates who passed their primaries in the West African primary exam, and so we soon start training as well. And we are involved in training with the West African College of Surgeons as well as the newly inaugurated local College of Physicians and Surgeons. So in training, it is very important, as has already been highlighted, that we train our specialists here to increase our capacity of care, and that is one of our core mandates. And I want to also take this opportunity to inform you that the Department of Surgery is also improving in terms of infrastructure. And thanks to the hospital care manager, the secretary, and the entire administration for facilitating the rehabilitation of Ward 2, which is the oncology ward, and the rehabilitation of Ward 3. And also underway is rehabilitation of the pediatric surgical ward, which is Ward 1. And the accident and emergency department is also going to be rehabilitated very soon. We are grateful that the theater is also being given a facelift. So generally, it is important to note that significant changes are taking place in Connaught Hospital, and to reassure the public that the Department of Surgery is here ready to render the requisite care for all our patients. Thank you, welcome, and welcome to the Department of Surgery as you go down.
Thank you very much, Dr. Levy. Our next speaker will be Dr. J.W. Russell. Dr. Russell is an associate professor of medicine and consultant cardiologist. He is also a chief physician and head of department for the internal medicine, both for the Commerce and Connaught. Ladies and gentlemen, Dr. Russell.
Thank you very much, sir, for such a brief introduction. Mr. Chairman, colleagues, the Fourth Estate, a very good morning to you all. On behalf of the Department of Medicine, I would like to express my sincere thanks and appreciation to the administration for organizing this meeting with the Fourth Estate for us to showcase that which we have been doing. And in the history of Connaught Hospital, wherein I have been a student as well as a senior colleague, this is the first time we are actually witnessing such a memorable event. Thank you very much, sir. The Department of Medicine is an integral entity working in collaboration with other departments. And as rightly been heard from my colleagues, we ensure that there is a smooth functionality of the hospital with respect not only in providing quality service to our patients, but also in terms of research and training of our junior doctors as well as registrars. For the purpose of time, it has already been elaborated on by Dr. Dean in terms of training. I'll spend most of my time talking about quality service provision for our patients. There is a proverb which I always like: coming events cast shadows before them. In other words, significant events are often preceded by signs that they are about to happen. And indeed, things are happening in Connaught Hospital, wherein we are seeing drastic, significant transformation of the hospital. Several months back, we all could attest to the fact that every now and then you wake up, Connaught is dirty, people are dying, but due to the astute leadership of Dr. Kaba and the dynamic administration, indeed, we have seen significant transformation. Within this very short period of change in administration, I will repeat once again that we have seen significant transformation in this hospital, and it is as a result of a colleague, a brother, young guys who've been able to steer the wheel of this hospital. And thank you very much, sir, to Dr. Kaba and the dynamic team for making us proud that yes, Connaught is indeed a place where transformation can take place. A clean environment fosters a friendly atmosphere. And it fosters a friendly atmosphere for us to work. And within the medical ward, unlike before, the wards are clean, extremely clean. And this is in comparison to what it used to be. We will do the tour and you can see that it is from my own man, Donald Trump. It is what it is. So there is cleanliness and it is what it is. In terms of infrastructural development within this very short period of time, 2 wards have been refurbished. Ward 6 by Toshpa, and if you go there, it's clean. The painting alone shows that there is a difference. Before you enter into any of these wards, the walls are so dingy at times you ask yourself, is this actually a hospital? But you can see that the paints are now white rather than the previous creamy dark paint that we used to see in the hospital. And the reason being, it's a translation of what is being seen out there to what we see in Sierra Leone. Because in other hospitals, the walls are painted white. But in Sierra Leone, they will tell you as usual, oh, don't paint it white because this is a public place. But Dr. Kaba and the team were able to define that traditional adage that yes, we'll paint this hospital white, and the hospital is being painted white. When we talk about improvement in terms of the hospital, Ward 10 has been transformed. It's not only been transformed for the admission of patients, but Ward 10, first in the history of Sierra Leone, that we now have a stroke unit. And in this hospital, from studies which have been carried out through King's Partnership, they've enrolled more than 1,000 stroke patients within a very short period of time. And during that research, they impacted significantly, not only in ensuring that service in terms of CT scan and labs are being provided, but the management of the patients were significantly impacted. And when you create a stroke ward, the principal objective of the creation of a stroke ward is to reduce mortality. And indeed, the stroke ward is geared in reducing mortality in patients who suffer from stroke. In medicine, we deal with the evidence. 1 in every 3 patients admitted to Connaught Hospital with stroke, like in other places, will die from their stroke. And there are so many reasons why the mortality is on the high side. Because by then, we had no stroke unit. By then, colleagues were not being trained specifically as to how we can handle stroke patients. But this is no longer the case, because we've had doctors, nurses, and other health workers who have been trained in Ghana through this hospital and with specific reference, King's Partnership, to ensure that they've been back so that our stroke patients can benefit. This is indeed a very big step in terms of achievement for this hospital. The stroke unit also has a significant role to reduce morbidity and complications, because most of our patients will die from complications related to stroke and not the stroke itself. So there is a stroke ward, first in the history of Sierra Leone, and which we are proud of, that yes, indeed, Connaught Hospital has a stroke unit, and you cannot find stroke unit nowhere else in Sierra Leone other than that of Connaught Hospital. Let me shift gear a little bit, sir. And in terms of the operations of the hospital, during the leadership of Dr. Kaba and the dynamic team, the dialysis unit has been refurbished, and it was recently launched. It's up and running, but for now, there are 1 or 2 modalities that need to be fixed. But we will take you to the dialysis unit to see that, yes, we are ready for business under the leadership of Dr. Kaba. I will definitely not dwell deeply into training, but how do we function as a department? We have top-rated consultants who've worked almost everywhere in the world. And many a times when patients move from Sierra Leone to places like Ghana, they will ask, but there are top clinicians in Sierra Leone. in Sierra Leone, and why are you coming over? You see, because medicine, to be honest, is about holistic care. And when we talk about holistic care, we talk about the physical, the psychological, the social, and the spiritual. And as doctors, we cater for the physical. And the vast majority of our patients, family members, they believe that, oh, if they come to Connaught Hospital, that's the end of it. But frankly to note, it's not the case. The department has several specialized farms. We have the Diabetic Clinic, which is headed by Dr. Dean, and he has seen thousands and thousands and thousands of diabetic patients in Sierra Leone. And we have the Cardiology Clinic, which is headed by no less a person than myself and other colleagues, and we've been seeing communicable diseases, non-communicable diseases like hypertension, diabetes, and other related disease conditions. We have a dermatology clinic which is currently ongoing in terms of service provision. We have a nephrology clinic which is spearheaded by Dr. Joshua Coker. We have an epilepsy clinic which is ongoing by Professor Radcliffe Lisk. A rheumatology clinic also should be ongoing, headed by Dr. Sayo and the others. Of course, we have an infectious disease clinic, an infectious disease building, to be specific, which was also established by King's Partnership. And it's only in this dynamic person in terms of consultant, Dr. Lako. Gastroenterology clinic is also headed by Dr. Tijan. And in addition to that, we have a cardiorenal clinic. We are in a cardiorenal ward, to be specific, wherein we admit specifically cases with cardiac diseases, that is heart disease, was non-functional before, is now up and running. And we've been having credible labs or results from the labs. Because in those days, you see a result coming from Connaught lab, you say, get it elsewhere. But we are having credible investigation from our labs. And so it be with the radiology department. Rome was not built in a day. And we always start with a baby step. And we are moving on. And I believe, should I say, this is a fast train that is moving. And we are moving in the right direction. Thank you very much.
Thank you very much, Dr. Russell. You're not surprised at all. Ladies and gentlemen, as an administration, we have succeeded to extend collaboration and partnership with organizations and well-wishers to co-own Connaught Hospital. Today, we have few in our midst, and we want to recognize them with few statements. We want to call on Kings, the representative, to make a statement. Kings is a global health partnership work to strengthen health system and improve the quality of care in 4 countries: Somaliland, Sierra Leone, Democratic Republic of Congo, and Zambia. They bring together health, academic, and international development expertise from King's College, London, the UK's National Health Service, and international partners to 1. Educate, train, and support healthcare workers, strengthen healthcare and training institutions, and finally, to enhance national health policies and systems. They connect UK and Africa health professionals, providing training, mentoring, and hands-on support, and undertake collaborative research to improve policy and practice. They also support partners by providing access to funds, networks, and development opportunities. Through long-term partnership, they promote skills and knowledge exchange and mutual learning that contribute to building a stronger health workforce and improve quality of care. Ladies and gentlemen, I want to call on my very own Cicely, the Rep for Kids.
Thank you so much. Chairman, Hospital Care Manager, distinguished guests, colleagues and friends, thank you so much for giving me the opportunity to talk about our work here in Sierra Leone. I want to start by talking a little bit about Kings's history in Sierra Leone, then about the projects that we have ongoing presently and our plans for the future. The King Sierra Leone Partnership was established in 2011 with the aim of strengthening health systems and improving the quality of care for patients in Sierra Leone. We've been embedded in Connaught Hospital since 2013. Our approach to partnership is a central component of our work, bringing together health professionals and institutions from the UK and Sierra Leone. This partnership is grounded in high-quality research and teaching, clinical and international development expertise, and an in-depth knowledge of the context in which we operate. At the heart of our partnership is a remarkable group of professionals from the National Health Service and UK universities who dedicate their time and expertise to make this possible. They work alongside our Sierra Leonean partners, creating opportunities for knowledge exchange and collaborative learning. We aim to co-design and co-deliver our projects alongside our partners. The King Sierra Leone Partnership's work has significant reach and impact across Sierra Leone because the doctors, nurses and allied health professionals who receive undergraduate and postgraduate training at our partner institutions are deployed in health facilities across the country. Some of our key achievements over the years are providing advice and hands-on support to the national Ebola response in 2014 and 2015, and supporting the Sierra Leonean government's response to the recent COVID-19 pandemic. We supported the development of the Referral Coordinator's National Referral System, ensuring that in an emergency, patients in rural areas can access the care that they need as quickly as possible. We've improved emergency and critical care, previously restoring the oxygen factory at Connaught Hospital, thereby reducing mortality rates in the intensive care unit by 20%, introducing triage and the Sierra Leone early warning system, SLUES, to alert doctors to patients needing most urgent attention, training on primary trauma care, and most recently designing and delivering emergency room training across 16 districts. We've supported the development of clinical services for the management of infectious diseases with a focus on malaria and HIV/AIDS, and we've supported the College of Medicine and Allied Health Science to strengthen an undergraduate education for doctors, nurses and allied health professionals, including equipping a clinical skills room here at Connaught Hospital. We currently have 3 projects underway at Connaught, with another one about to start. The largest of these has already been mentioned, the Stroke in Sierra Leone project, funded by the National Institute for Health Research. It's a research grant led by Professor Catherine Sackley and supported by Dr. Dean and Dr. Lisk and Professor Lisk as the co-principal investigators. It aims to improve outcomes for stroke patients in Sierra Leone, and it's a collaboration between King's College London and COMAS here in Sierra Leone. Some of its notable achievements, in addition to some very interesting publications, are, as mentioned, the creation of Sub-Saharan Africa's largest stroke register with over 1,000 participants recruited to it, supporting the setup of a stroke survivors group, supporting stroke-specific education and training here at Connaught, and undertaking infrastructure projects such as the renovation of Ward 10, building a ramp to improve accessibility, renovating patient facilities, and building an accessible bathroom here at Connaught. These infrastructure works, as mentioned, are supported by education. 8 staff members were given the opportunity to spend 2 weeks at Korle-Bu Teaching Hospital in Ghana, where they received holistic, multidisciplinary education in stroke. That team is right now, as we speak, working to cascade that knowledge, which they've adapted to Connaught's unique environment, to the teams who will be working on Ward 10, as well as other key members of staff, to ensure that stroke patients receive specialist, evidence-based care here at Connaught. We also have a project where a team are working embedded within the matron's office to develop a system for continuing professional development for nurses in Connaught, as well as supporting education and training. So far, this project has trained 135 nurses in the Sierra Leone Early Warning School, providing the foundation for their continuing professional development, delivered 40 blood pressure monitors and 32 thermometers and spare parts, as well as 3 specialist vital signs monitors for distribution amongst the wards at Connaught, ensuring timely monitoring of patients, all this supported by education. They've equipped 30 emergency department nurses to assess and manage acutely unwell patients through rates for nurses training courses. And they've trained 16 education lead nurses representing their wards and departments as champions for training and supporting their peers with on-the-job teaching. The third project is working on institutionalizing antimicrobial stewardship in Connaught Hospital. And this includes training 10 early career pharmacists to become accredited antimicrobial stewardship champions and supporting Connaught's Antimicrobial Stewardship Committee to strengthen processes and controls through the review of existing antimicrobial guidelines and the implementation plan for guideline use. We're about to begin a project which will work to embed the learning from the recent explosion in the medical and therapy teams who worked with the burns victims, as well as supporting the development of a national burns register. As for future projects, we're working with the head of the outpatients department to develop a project that will complement the renovations of the outpatient department and support the development of the department, focusing on education, training, and system strengthening. We have a deep commitment to working in partnership and hugely value working alongside our friends and colleagues at Connaught. Thank you.
Thank you very much, Cicely. Founded in 1950, Doctors with Africa, QAM, was the first non-governmental organization focused on healthcare to be recognized by the Italian government. It is now one of the leading organizations working to protect and improve the well-being of health of vulnerable communities in sub-Saharan Africa, especially in Sierra Leone. Ladies and gentlemen, I want to call on the rep for QAM.
Thank you, Mr. Chairman, Hospital Care Manager, distinguished guests. I'm delighted to be with you today on this occasion at Connaught Hospital, the principal adult referral hospital in Sierra Leone, caring for acutely unwell patients from across the country. And I would first like to thank Dr. Kaba for his invitation. Allow me to just quickly introduce the NGO I'm representing here. So, Doctors with Africa QAM is an Italian NGO which has been working in Sierra Leone since 2012 in close partnership with the Ministry of Health and Sanitation. Our mission is to enhance access and providing quality health services delivery in Sierra Leone, working at community, peripheral health unit and hospital level. We started the very first activity here in Pujeon district in 2012. Then we expanded in Bont district and Bo, and we supported the establishment of the National Emergency Medical System that we handed over then to the Ministry of Health in 2020. Here, as mentioned by Dr. Dean, in Western Area Urban District, we are supporting the main maternity hospital in the country, PCMH Hospital, since 2016. Today, as per direct request of intervention from the leadership of Ministry of Health for support towards the strengthening of emergency care with the establishment of the emergency room at PCMH and Connaught Hospital in Freetown, QAM wished to express its availability and is therefore willing to support Connaught Hospital in this sense. As per largest governmental hospital, it is also one of the busiest with several demands on its services, and in order to further improving quality of care and outcomes for patients with trauma, life-threatening illnesses, Connaught Hospital management wished to establish an independent emergency department to improve the quality of care and clinical outcome for adults with medical, surgical, and trauma emergency. In supporting this outcome, QAM has already started an analysis aiming at identifying the suitable way for improving the functioning of the emergency room and outpatient department unit accordingly. As partner, we will definitely work alongside hospital management and Ministry of Health and Sanitation and all the partners working at Connaught here to accomplish the mentioned intervention. So I would like to conclude by thanking again Dr. Kaba, and we look forward to a productive and successful partnership with you all. Thank you.
Thank you very much. Ladies and gentlemen, as a team, we are happy to be led by a fine gentleman, a personality of example, a dedicated and God-fearing personality, a happily married man, and a father of 2 lovely children. A manager and a leader in its right definition. He is a member of the German Board of Certified Consultants, General Surgeon, Visceral Surgeon, and Proctologist, Fellow of the German Society of the Visceral Surgeon, Fellow of the German Society of General Surgeon, Fellow of the Postgraduate College of Health Specialties, Sierra Leone, and Lecturer of the Department of Surgery for Commerce. Distinguished ladies and gentlemen, pray silent as I call the master for this ceremony, who also doubles as the hospital care manager, Dr. Mustafa Solufo Kaba.
Thank you very much, Mr. Fode Musa Hospital Secretary, our able Hospital Secretary. I stand on existing protocols and I welcome all distinguished ladies and gentlemen here, our high table and members of the Fourth Estate to Connaught Hospital. And I'll maybe just take off my mask so that for visibility purposes. I usually don't do it, but I will do that today. So I will just give a brief statement. I think my own statement will just summarize the statement that has already been made by various speakers, but it is also good from the administrative perspective to really give information to members of the Fourth Estate and distinguished ladies and gentlemen gathered here. Connaught Hospital is the country's main referral hospital for complex surgical and medical cases. It is part of the University of Sierra Leone Teaching Hospitals Complex. As such, its main mission consists of medical care, training, and research. Connaught Hospital has an admission capacity of approximately 350 beds. It is fortunately the hospital with the highest density of specialized and subspecialized doctors. Compared to other private institutions, it is usually frequented by low and middle income earners because of its generally low cost and in the past limitations of basic medical service delivery and lack of conducive environment for patient comfort. All of which are intricately connected to the poor reputation Connaught Hospital has been suffering from. At the handing over to the current management, not even basic service delivery was guaranteed. It is obvious that this situation cannot be changed instantly, As such, a strategic plan was developed based in phases to make sure that this development is properly implemented. Phase 1 of the strategic plan involves to provide basic services in the hospital on 24 hours basis, meaning stabilization of the situation. Phase 2 is to consolidate and expand on specialist services. Phase 3 is to develop an excellent teaching hospital adjusted to the needs of the sub-region. At the moment, Connaught Hospital is experiencing a rapid and positive transformation. Several infrastructural developments, as mentioned by previous speakers, such as renovation of 5 wards in 6 months, which have taken place. The annex building, the duty house, are under reconstruction. We hope to start renovation at the outpatient department, which is a very difficult place. Contractors hired by the government of Sierra Leone have already been handed over through our Minister of Health and Sanitation, Dr. Austin Demby, to continue with the rest of the renovation work at Connaught Hospital. A specialized stroke unit has been established, as mentioned, with a ramp facility. Our oncology unit is now renovated and fully functional. Our laboratory is equipped and supported with reagents to provide basic laboratory investigations like we had from Dr. Russell, not only to provide the services, but it also comes with quality. The surgical theater has been providing uninterrupted services for the past 6 months. We are also proud to say that complex fractures for which people used to travel abroad or we used to refer patients to other facilities can now be managed at Connaught Hospital at minimal cost, thanks to the cooperation with Signal, an organization in the USA. The revenue mobilization drive has also been very intensive, which saw the revision of our service charter. This will provide necessary basic funds for further stabilization and enhancement of service delivery in the institution. A dedicated waste management truck is permanently located at the hospital, thanks to support from the Ministry of Local Government and Ministry of Health to dispose of our medical waste. That means we have our own waste management truck. When waste is collected, it is taken to the dumping site. One incinerator has been refurbished and another one has been built by MSF. We'll show you this one as we take the facility tour. A glass crusher has been installed at Connaught Hospital to crush waste empty bottles where medicines are stored. And we are assured of a 24-hour water supply and electricity supply through our national grid, backup generators, batteries, and the Goma Valley water supply system. So we don't have issues with electricity and water supply at Connaught Hospital. Our outpatient services have improved dramatically through allocation of more staff, including a consultant family medicine physician, as mentioned by Dr. Dean. We have improved on our duty roster, and these rosters are published weekly and made public. So you as the public can also know which doctor was supposed to be on call, why he was not on call when you are there for your patient to be seen. Complete renovation and equipment support to the unit will commence soon through support from the MOHS, QAM, and training of staff on emergency care is embedded in this process, which will also be the responsibility of Kings as we move on. Our service charter has been revised, as I mentioned earlier, and is displayed at all essential points, and services must be paid for at the hospital bank, manned by Rokel Commercial Bank. This is a very important point. The services we deliver in this hospital have been developed into a service charter, and for each service there is a price allocated to it. So no staff, no member of this hospital is allowed to take money from people who come to seek services in this hospital. The charter is displayed for everybody from the public to know how much to pay and where to pay. We have a bank, like I said, being manned by commercial bank, so that the money is sent to the central bank and then we request for use of these funds. Like mentioned by other colleagues, the hospital continues to provide free medical services to under 5 children, lactating mothers, destitute, war victims, disabled, etc. and we recently successfully managed severely injured victims from a major fire disaster. We also supported through this activity other hospitals, and as a result, 65% of the patients who were treated here were discharged to their families. Establishment of a bonds unit will further strengthen our capacity to properly manage future incidences. Our challenges: provision of more equipment and consumables to support and establish specialized units. As we are moving now into phase 2 of our strategic plan, we need more support for equipment and consumables so that these specialized units can be fully functional. Provision of staff transportation services, training of staff, staff health insurance, and motivation of staff. More specialized staff in areas now where we don't have any specialists. Expansion of wards and units to create space for the increasing number of patients seeking medical care in the facility. As we can attest now, the number of patients coming to Connaught has rapidly increased because of the new transformation and rebranding of the facility. Proper internet facility to digitalize patient and administrative records and processes is essential in ensuring that we establish the phase 2 of our development plan. We need to establish a destitute fund. The hospital is really bombarded with a lot of people who come to the hospital who don't have funds for medical care. So usually the hospital takes responsibility, but it's a huge burden on the hospital administration and the Ministry of Health per se. So we are looking at a strategy of developing a destitute fund where there will be a separate fund that people can dip into whenever there is a need for these patients to receive adequate care. I will end by just giving a brief statistic of what we have achieved so far in terms of patients we saw last year. General and outpatient, including emergencies. This hospital saw a total of 60,015 patients. Specialist outpatient, that is where the specialists are seated to see patients. 26,400 patients visited the clinics in the hospital. The hospital was able to manage 3,057 free healthcare patients. Admissions in the wards last year was 4,860. We were able to perform 2,005 surgeries, and 4,461 blood transfusions were done at Connaught Hospital. So in a whole, this is what we present to the members of the First Estate, our friends and people who came to support us. And I thank you very much for listening, and we'll now move on to the facility tour, which will Q&E, okay? I wanted to step that way, go over that, because I think we'll do that fast and we'll do the facility tour. All right, okay. I thank you very much.
So thank you very much, Dr. Kaba. Ladies and gentlemen, members of the Fourth Estate, the essence of this gathering or this meeting is to actually inform you about Connaught Hospital and what we do in Connaught Hospital. And I think the first session will take 4 questions, and then
the people we are crying at, there are a lot of people lost their life when they gone to seek medication. How far have you gone to see that issue have stopped? Thank you.
Good morning, Mohammed Ba from our police. I think when manager was speaking, he made mention of 30 figures to ask for admission. So I want to know exactly the number of patients that you admitted in 2021.
Yes. 4,860.
two more, please. Then they will respond.
John?
Good morning, I'm Barry from Star Television. Thank you very much for opening up what has always been a tight-knit community. And we're happy to be giving some insight about what is happening here. My first question, sir, is
know the cost of the renovation that has just been done, and of course the duration too, and I also want to know how many beds and doctors, nurses do Connaught Hospital have? And nothing was mentioned about cancer. I want to know how far.
So thank you very much. So the team will respond and then we'll take the second session, the last session soon.
Yes, thank you very much. I've been noting down the questions. One of the first questions was the issue of the dialysis. The dialysis was opened, commissioned, and it is fit for purpose. We have a challenge with our water treatment plant. That is why it has to be seen by a consultant who is a biomedical engineer. He's on his way from Nigeria as we speak, so that he assesses the water treatment plant so that we can have proper repairs to that system. But all other systems in the dialysis unit are functional. Patient dying at Connaught Hospital, of course, this is a thing of the past. Like I said, we have modified our system in the outpatient, so patients are not delayed in terms of seeing a doctor. And we have, in terms of internal audits, quality assurance measures in place to make sure that deaths are properly monitored. And we have mobility meetings which we are instituting so that we understand the causes of death and follow them and address the matters accordingly. The issues about doctors, nurses, interaction and attitude to the public is a very difficult one. We are working on it. We inherited it. It's not only for Connaught Hospital, it's a nationwide problem. And we are putting in place mechanisms for people to seek redress, like the other colleague just asked, that you can have a complaint box. We have a complaint box placed at the entrance of the hospital, where if you have a challenge, if there is a situation you are not happy with, you can always write your complaint and put it in that box. Definitely that complaint will reach us and then we'll address the issue. And what we have instituted is that whenever a nurse or a doctor is caught founding in terms of indiscipline or actions that do not meet to the medical codes of ethics, there is a disciplinary committee which we have that will sit down and address the matter, and these individuals will be disciplined according to the civil service codes of conduct. The amount of nurses and doctors we have about 15 consultants. We have close to 10 specialists at the level of registrars, senior registrars. We have about 11 medical officers. We have about 46 house officers, and nurses is around 404. The issue about cancer, I think I mentioned it, that we have a new oncology ward. It's oncology. It's at Ward 2, and cancer patients can receive care at Connaught Hospital. I think with these I've answered most of the questions.
We want to take the last set, last 4. We want to assume there are no more questions. Then Master of Ceremony will take us to the final stage, which is the talk. He will guide us on how the talk.
Yes, I think we have a plan for the facility talk. We'll go through the entrance of the hospital, which is where you as a patient you start into the hospital. We'll go through the bank, where you pay. We'll go through the pharmacy. We go through the triage system, the outpatient, laboratory, annex, the wards, and then we exit. Okay? So please follow. And thank you very much for coming.